Hello, I'm Mally Shansfeld, Managing Editor of Implant Practice US, a MedMark publication. Welcome, presentation, and question and answer with Dr. Leo Haydt. In our webinar today, we will be discussing how to use dental robotics to grow an implant practice with efficiency and consistency. Before we get started, I'd like to invite viewers to use the chat box on the right side of your screen to ask any questions, and your questions will be answered at the end of the session. Now, I'm pleased to introduce our guest for today. Dr. Leo Haydt graduated from Boston University Goldman School of Dental Medicine. During his 4 years at Boston University, he went on several rotations, learning advancements in dentistry, such as implants, CEREC restorations, and oral surgery techniques. Also, while attending Boston University, he won the prestigious Student Award of Merit from the American Academy of Aesthetic Dentistry for his cosmetic work. His professional credentials include being Invisalign certified, CEREC certified, an American Academy of Aesthetic Dentistry award winner, conscious sedation certified, American Dental Association member, and Docs education member. Dr. Haydt, we turn the webinar over to you to learn more about our topic for today.
Great, thank you. Topic of today is to talk about how to implement the Yomi robotic system into your office to help grow your practice. And there's a bunch of different ways this happens, and I'm going to tell you my story and how I came to buy two. That's the basic topic here. So a little bit about myself. Graduated in 2009. Started my first office in 2010. It started expanding. I started to see the potential of implants and how they affect an office. And so about 2011, I started to go into implants, started diving into it, and really started focusing on the implants and the oral surgery parts of the office. That journey, I realized that you really can't do everything. And so I started hiring on associates throughout the expansion. Currently we have 4 associates. And prior to the Yomi, and before I bought this thing, the problem was I was placing 95% of them. And so prior to me even seeing the Yomi, I was doing the majority of the implants, if not all the implants in the offices. And that becomes a little bit of an issue because really that becomes you're the limiting factor in how much it can grow if you are the only one placing the implants. So before we get into that, I want to talk to you a little bit about what I enjoy. Okay, because if you think about growing an office, you think about growing an implant location, and if you're thinking about growing the size, the scope of your implant practice, and you're the only one doing it, a lot of this goes away. You know, I love golfing. I love snowboarding. I love taking my bike out. Have a Harley. Love it. It's called throttle therapy. Love hunting. Love going out west, going elk hunting, deer, you name it. Love spending time with my family. This is a little part of my family. My 2 little boys. We were up in Big Sky, Montana. And this is us on top of Lone Peak. They had such a great time. And the other thing I enjoy is not having to place every single implant that comes into this office. And so this is the story of why I bought 2 Yomis. So when we were getting into full arch and really diving into the implant growth mode, one of my associates, and 2 of my assistants went down to Orlando for a conference, and throughout the marketing meeting, they were talking about how much we were going to grow. And I'm sitting there thinking, this is great. I love it. Love growth. And then I started having the cold sweats and thinking, a little mini panic attack, thinking, I don't have time now. What happens if I place 4 times the implants? Where is my time going to go? This stuff. How am I going to find time to golf? What am I going to do with my family? What am I going to, is my bike just going to sit there and rot away? What exactly is going to happen? And so throughout the meeting, my mind is spinning. I walk outside and the meeting, and I saw the Yomi robot. And I looked at it, and I will be honest, the first time I saw it, thinking, well, okay, that seems like a lot. Maybe I don't necessarily need this right now. So I'll walk up and talk to Barbara, actually, who's the rep. And as I was talking with her, something clicked. So I grabbed the robot, asked her to make me an osteotomy. And so I just kept pushing it in and out, and I was talking with her, and she said, what exactly are you doing? I said, just keep talking. After about 20, 30 movements of this thing, I took it up with the burr, and it fit perfectly. There was almost no deviation from it. And then something clicked. if I can implement these robots and I can build a surgical plan into the robots and my associates can't deviate from it, or if they do deviate, it is adjusted within the parameters of what we set for an office, I can grow these things. And so I looked at her and said, give me about 15 minutes. I went back into the conference, sat down, wrote some numbers down, and I said, I'll take 2. The reason why we bought 2 is I have 2 offices. You can't build a robotics office and not have another robotics office. So one can't be of one standard, not the other. And so I was very relieved to run across this, because now I'm not placing all the implants. I still get to do surgical planning, but this is why I bought 2, is to take that bottom number, the 95% or 97%, and decrease it so I can do things like this with my family. So everyone knows the clinical part, right? So this thing is extremely accurate. This patient specifically, this robot bailed me out from this patient. This is a patient that we did a beautiful grafting case on. But you can see the location of the nerve. We did a beautiful graft, grew bone, dense bone, trabeculated, looks great. But getting that implant in was going to be tricky. Utilizing the accuracy of this robot, I was able to sneak in an implant in between the IAN and the lingual portion of the bone. Now, without this robot, even a stackable guide, this is not something I would even try. So what this allowed me to do is not compromise the site. I was able to place a specific type of implant, the correct length of an implant, to support a crown. And again, freehanding this, not a chance. Stackable, again, not a chance. But this robot is so precise, that is exactly where I placed it in the surgical plan. That's exactly where it went. Now, this is the surgical part. This is the clinical part. Now, the why for the team. Now, as you grow an implant practice, as you know, if things go wrong, it is not an inexpensive fix. So for instance, if you're growing your office and you're doing crown work, if you do a number 30 as an open margin, okay, it's a bad day, but it's not a really, really bad day. You bring the patient back in with the CEREC machine, cut it off, you reprep, you rescan, you put it back on, it's a 2-hour appointment, the patient's minor inconvenience. If you get into grafting cases and implant cases, and your associates or you place an implant that is not clinically acceptable, that needs to be redone, and heaven forbid that patient is nervous, what happens is that patient has to come back in, get resedated, another surgery, some more time. That becomes extremely costly, and not to mention detrimental to your office. With this robot, what this allows me to do is go golf, go relax, go do those things, because I plan these implants with my associates, knowing that when they go into that surgery, that implant will be exactly where I planned it. Now, for full arch surgeries, this thing is a beast for full arch surgeries. The planning software on this is extremely accurate and extremely user-friendly. It is a dentist-based planning software. You can plan a full arch accurately within 15 minutes. I've never used a software anything like this. The surgical time, the time in the chair with the patient is minimal, but the actual surgical part is the biggest key here. The time under surgery, the time under the knife is greatly reduced, because you're not guessing, you're not trying to fit keys, you're not trying to fit burrs in the keys, in the small little holes. You're not, if you are freehanding it, you're not trying to visualize the bone. With this, you don't have to do any of that. The robot already has the surgical plan in place. You're literally just using that robot to move across the osteotomies with extreme accuracy, and you can move through fast with these things. Also, it's less invasive. Your flap design is minimal. You only have to flap to where you need to reduce. When you put the link on, that link serves as a stability point, and also serves as a point of reference. And so when you're doing these surgeries, again, on stackables, you don't have to flap as much as you do with stackables. You definitely don't have to flap as much as you are freehand. The less flap, the smaller the flap, the better the clinical healing. Now, what this also means is that you can do more surgeries in one day. So instead of taking maybe 2 arches in one day, 1 arch the next day, 2 arches the next day, you can do 4 or 5 arches in one day with this robot. And now you are producing more. And now you have other days that you can take some time off. Again, go golf, go ride your Harley, go hunt, or whatever it is that you do for fun. Now with associates, this has helped me grow my associates. I've seen a huge difference, not just associates, but also my staff. The engagement level in the staff and associates was through the roof. I came back, told them about these robots, and immediately they engaged in this thing. Now, with my associates, we have a couple of 4 associates, 2 of which place implants, one of which places quite a bit of implants. The other 2 really don't place implants. Now, with this robot, they are now placing implants at different levels. Some are placing singles, some are placing 3 in a row, some are doing full arch with this. But this allows them confidence. So when they go in, they're not as hesitant, they're not as slow, they're not guessing. This gives them the confidence to go in and know, look, these implants are going to be placed by the book and extremely accurate. And there is a team, me and my associates, we all sit down and we go through these cases together. So everyone is on the same page about where these implants are going to go. This also gives them the freedom. So now, instead of me having to hover on surgery or schedule their surgeries around the days I'm there, or calling me, asking me if it's okay to do these surgeries, now they know they can do them. Whatever their confidence level is, they can do. Their skill level when it comes to implant placement goes through the roof as well. So this is something where utilizing this technology makes you a better surgeon, no matter how many of implants you placed. So you can literally, by the book, plan this implant, walk into a surgery knowing that implant is going to go exactly where you planned it. Also, when you engage associates and you engage staff members like this, you're decreasing burnout. If you have a staff member that is constantly drilling and filling and banding, and that's all they do all day long, your career becomes shorter and you don't look forward to going to work. Now, instead, utilizing these robots and engaging the staff, engaging my associates, that burnout is almost nil. They're excited to get into this. They're excited about jumping into implant. They're excited about using the robot. Now, this is why I bought this. This is an implant that was placed, and this is a bad day, right? This is something that now needs to be fixed, right? So if you own an office and this implant was placed, what do? Right? So say this patient was sedated and was very nervous. Now, not only do you have to explain to the patient why to do another surgery, you increase the cost. You have to get the patient resedated. You have to take that implant out. You have to regraft. You have to put the new temporary on. All of those things add to time and money. And money is one thing, but time is the other thing. So again, guess what I'm not doing today? I'm not going golfing. I'm not going to baseballs. I'm not going to hang out with my kids. I'm going into a surgery to fix this and try and mitigate the damage with the patient. This is why I bought this. So how this robot works. So you go ahead, use the planning software. Me and my associate plan it textbook using zero bone loss concept and all the literature that is out there. We plan this using the software. Next, we take the patient in. I actually wasn't even here for the surgery. My associate went in, attached the link, attached the patient to the robot, and then placed these 3 implants. Perfectly parallel, perfectly guided, perfectly set up for the restorations. Everything about this surgery was perfect. And I was here. I was actually teeing off as my associate was doing this. Now, my associate that did that case had placed 10 implants before that. That was implant number 11, 12, and 13 of hers in her career. Those things are, again, perfectly placed by the book, perfectly set up for screw-retained crowns, and was completed by the time I probably got the whole 4. And I got to golf while this was being done. Now, one of the things I did when I saw this is I was trying to figure out how to pay for this. And so that was the little hesitation I had in there and thinking, okay, how can I make this work and make this make sense financially? So I came up with something called a robotics fee. It's very simple. We all charge for guided fees. We all charge for little things here and there. Guided fees usually run, I don't know, $800, $900, $1,000, $1,200, whatever you charge the patient. Instead, what I did was I took the monthly payment for the robot, plus the osteotomy fee for every implant placed. I divided it by how many implants placed per month. It's a sample on the right. And I came up with the robotics fee. Now, this isn't my robotics fee. This is just the robotics fee I came up with. So what we did is we attached, let's just say I was this office that placed 50 implants a month. I would attach a $246 fee to every implant. And what that does is it pays for all the osteotomy fees and a monthly note on the robot. So now you have patients paying for the robotics fee, which is technically a guided fee, that pays for the osteotomy fees and the monthly payment. So now you are free and clear of the robot. The robotics fees, again, that fee pays for all the osteotomy fees and the monthly implant. Now, we also use this as a marketing tool. So every treatment plan has a robotics fee in their highlighting. So when we are doing our marketing, when we are doing our case presentations, and a patient wants a second opinion, we ask them to ask the question at their next opinion, at their next consult, how much are your robotics fees? And ask them if they don't have a robotics fee, why they aren't utilizing robotic technology. That has worked out very well for us in marketing. The robotics fee, I was a little apprehensive about putting this fee on there, thinking patients aren't going to like it. In the 7 months I've had, 6 months, 7 months I've had these implants, I've had these robots in both offices, I have never had one patient turn down the robotics fee, ever. In fact, if anything, it has been a huge sales tool for us. Now, this patient, this is a full arch that was done by an associate of mine. Now, this associate has done one arch on a stackable one time in his career. He completed this arch, or these arches, and delivered. He did the surgery within 2 hours. I think it was an hour and a half, something like that, sometime in the morning. These implants are perfectly placed. The bone reduction, everything across, everything looks great on this case. And this is just post-op to what he did. Now, this is the case. This is arch 2 and arch 3 in his entire career. While he was doing this, I was here. I was in the mountains of Virginia listening to Garth Brooks on my Harley. Had I not had this robot, I'm doing that case. I don't get to be on that bike. I don't get to see that sunset and those beautiful Blue Ridge Mountains. I'm in that operatory working away trying to place these implants. Instead, with a robot, I get to be on this bike. And I get to listen to Garth if you guys are country fans or not. So let's talk the numbers of this thing. Now, what I've seen personally in the 4 months of owning this thing, from the previous 6 months, I've seen a 91% increase in the first 4 months of owning this thing from the previous six months of implant placements. What that means is I've seen $81,900 a month of increase in implant production just by utilizing these technology. And what that means is I've also seen 46 more full arch consults per month. Now, the reason I get to do that is because my time is freed up. I'm not spending as much time in the operatories. I'm not spending as much time doing all of the surgeries. I get to do more consults. Now, my implants now are placing about 40% of the implants. What that means is that I'm placing less implants. I get to do things that I like to do. I'm not saying I don't like implants, but I also like to do other things as well. And there are other big things associated with not only just the numbers of utilizing this, but in here, you get 100% tax deduction of the year per purchase. That was huge for me. And there's something called an R&D credit that you can utilize with utilizing the robot. And that is something you talk to your accountant about. Now, again, if you think about owning an office and owning multiple offices and having associates, what are you giving up by not buying this thing? So again, peace of mind. You're giving up peace of mind. You're giving up that motorcycle trip and not worrying the entire time of what's going on in the surgery. In the back of your mind, you're thinking that implant's gonna be placed again, like that slide I showed, right through the buccal plate. I've got to go fix it. You're giving up the fast, quick efficiency of full arch surgeries. So the planning, the software, That gets more complicated. The surgeries, they're slower. Surgeries are slower, they're more invasive, which means there's worse healing, there's more bruising. And you're doing less surgeries in a day. Also, your associates. If you have 4 associates like me and they are doing a bunch of the drill and fill and they're doing some of the simple implants and things like that, and you are doing the more complex things, which they think is the more engaging and the more advanced procedures, they're going to lose confidence. They're going to feel like they don't have freedom because you're going to be overseeing them as much. Their implants, they're going to have a steep learning curve on these implants, as we all did when we first started placing implants. You're going to have to watch that. You're giving up that increase in skill level immediately. Also, you're going to get burnout. Your associates, your assistants, if the lack of engagement in new technology and growth is going to continue the burnout process. So with this, we'll always ask the question is, well, what does your future look like? What do you want? If you're trying to grow your implant office, if you're trying to grow with your associates, how? How do you grow it? Where do you look? Where do you want to be in 5 years? If I turn this marketing up and my implant process and my implants grew 91%, that means I'm placing 91% more implants. You look back at those slides, that means I'm not doing what I want to be doing. And I am now the limiting factor. Without these robots, with the robots, you're no longer the limiting factor.
Thank you, Dr. Haydt. There are some questions coming in, but before I get to those, I'd like to invite viewers to use the chat box on the right side of your screen to ask any questions you have. I have a question coming in already. What was the learning curve like with the robot?
So when you first start using the robot, the learning curve isn't as big as you think. It's just different is the best way to describe it. So the path of insertion of using the robot in the arm is probably the biggest curve. But again, it's not hard, it's just different. After that, everything else is exactly the same. In fact, if anything, it's significantly easier. So the best way to describe it is it's not that steep of a learning curve, it's just a little bit different. It took a couple surgeries, I would say by the 3rd day, we were doing a full arch.
Okay, another question. How have patients responded to robotic procedures?
Resoundingly. This itself has helped us separate ourselves from offices in the area. And patients are extremely engaged in the robotics process. I get more questions about the robotically guided implants than I do on the full arch digital workflow. I spend most of my time explaining the robot and showing people the robot and talking through it.
Okay, how long does it take to make intraoperative changes?
So intraoperative changes are done on the fly. It takes seconds. What we did is one of our assistants, a bright young woman, is our driver. And so if I'm going to place this implant and I notice something that I don't like, it takes me about 2 seconds to pull the arm away from the patient. I tell them to hit pause. I tell my staff member to move the implant 1 millimeter distal. She clicks 4 times. She tells me she's ready. I say guide, and I go right back into the implant. That whole process takes 30 seconds, 45 seconds.
Wow, okay. Does it do any other procedures besides implants? And if so, what?
So yes, they just came out with a new function of bone reduction on here. And so it is doing bone reduction now.
Okay, and the last question, how does it differ from dynamic navigation like XNav?
So I'll be honest. I looked at an XNav about 2 or 3 times they came to visit, and the system of XNav was the best way to describe it was like a video game. And so it is very hard to get the accuracy on the XNav. It's much more visual, and it's much more dependent on the doctor using it. Yomi doesn't care who has their hand on this handpiece. The machine will guide you into the right placement rather than the XNav giving you sight to get to the right spot. And the Yomi will lock the path of insertion in, which is a big difference. It will not let you deviate from that.
Okay. I don't have any more questions right now, but thank you everyone for your questions. But we have run out of time today. If we did not get to your question, we will answer it after the webinar via email. Thank you all for attending, and a special thank you to Dr. Leo Haydt and our sponsor for this webinar, Yomi by Neosis. Thank you and be well.